Brought to you through the regional support of First 5 Fresno County, First 5 Tulare County, and First 5 Madera County. Because it's all about the kids.
According to the Journal of Pediatrics and Health, constipation is common among infants and children, accounting for 3 to 5% of visits to pediatric clinics. It can be extremely painful for the baby and scary for the parents. Not to fear, we'll have a few tips on what to do if you suspect your infant's stool is at a standstill. Little Jessie Clark is just 4 months old. Jessie's mom says she's normally a very happy baby until she tries to poop.
You feel terrible. She's in a lot of pain. There's not a lot you can do. She doesn't want to pass her stool because it's not comfortable.
Dr. John Inouye is a pediatrician at Kaiser Permanente in Fresno. He says constipation is typically defined as not having a bowel movement for about 3 to 4 days.
If the baby hasn't had a bowel movement in a couple of days, not to necessarily, hit the alarm button right away, but to kind of look at what's going on with the baby, assess the situation.
Normal infant bowel movement should have the consistency of mashed potatoes. Stools that are dry and pasty are hard to pass. To get things back on track, Dr. Inouye has a few suggestions. First, try adding water to the baby's diet.
But you have to be cautious about using water, because what you want to make sure when you're using water, it's not replacing the actual nutrition of the breast milk or formula.
Karo syrup has been used for a long time and is still used today by many pediatricians. So if water doesn't get things moving along, a little Karo may do the trick.
The use of Karo syrup is kind of a little bit of controversy, so you have to use it very cautiously and maybe use it on an individual basis.
If that doesn't work, you might want to pick up some apple juice,
which helps draw more water into the intestinal tract, and then it helps soften the stools.
Occasionally, pediatricians will recommend over-the-counter medicines.
Sometimes we use things like Miralax, which is a newer form. It's now over-the-counter. Before it used to be prescription.
If all else fails, a suppository may be advised by your baby's doctor.
We do use, in an acute setting, is the glycerin suppository, and that's kind of a immediate relief for that child that's having problems.
Joyce has found that massaging or applying pressure to the tummy seems to help Jessie.
If she's going through pain, it'll keep her from sleeping. She'll just work herself into a frenzy, and we'll just be soothing her for hours.
Dr. Inouye says it takes good old teamwork to solve the baby's issue of constipation. In time, your child should be able to have regular, soft bowel movements.
Most parents are very intuitive. They really watch their babies quite well. So I think that's always helpful for me, because they give a good history of what is going on, and so we work as a team to help that happen.
Of course, if infant constipation persists, it's best to contact your baby's doctor.
Brought to you through the regional support of First 5 Fresno County, First 5 Tulare County, and First 5 Madera County. Because it's all about the kids.